Hello, my name is Emily Lucas, and I'm a student in the George Mason Master of Science in Health Informatics program. This presentation on diabetes and predictive modeling was prepared as the final project for the HAP 671 class in this program. In 2005, it was estimated that 20 million people in the US had diabetes, and 30% of these cases were undiagnosed. Between 2012 and 2015, the number of cases grew by 700,000 people, and the estimated cost in 2017 for managing diabetes was $327 billion. Diabetes can result in cardiovascular disease, kidney disease, and extremity amputation, and managing blood sugar, blood pressure, and blood lipids can assist in controlling diabetes. However, by using data from an EHR, informatics specialists may be able to develop predictive models to assist with predicting diabetes based on other conditions. The data used in this presentation was simulated from a major healthcare system in the United States. This slide shows the unique number of patients and the total number of records in the data. To define diabetes, the Clinical Classification Software, CCS, was used to group ICD-9 diagnosis codes. The diagnoses shown in the screenshot were all considered, quote, diabetes mellitus without complication and diabetes mellitus with complication. A comprehensive set of diagnoses in the data were used to predict the presence or risk of diabetes. There were 5,268 unique diagnoses that occurred 29 or more times. Age was assessed from 40 to 99 years of age. However, gender was not added as a predictor. Obvious predictors of diabetes would be those that also include diabetes in the description of the ICD-9 code. While there are many, a few examples include diabetic cataract, diabetic retinopathy, and polyneuropathy in diabetes. These codes were not included in the definition of diabetes for this presentation. Here are a few examples of rare predictors of diabetes. The data was filtered to include those where a diagnosis occurred at least 29 times and the patient had been diagnosed with diabetes. Based on the findings of the predictive model, this is a list of the top 10 predictors of diabetes. The top 3 include essential hypertension, hyperlipidemia, and tobacco use. To aggregate the data to overall risk of diabetes, naive Bayes was used. The given formula shows the probability of A occurring given that B has occurred, which is calculated as multiplying the probability of B occurring given A has occurred with probability of A, and then this is all divided by the probability of B. In the code, the likelihood ratios are calculated, which are then used to calculate the odds and probabilities. This case is specific to patient number 458. The ICD-9 codes for this given patient were found, and then the probability and odds were also found. The individual probabilities can then be used to calculate the total for this patient. To cross-validate the study, 80% of data is set aside for training, and then 20% of the data is then used for validation. This cross-validation is used to determine whether or not the model is appropriate, and this is very important. To determine the ROC, or receiver operating curve, sensitivity and specificity must be calculated, as shown in the code. On the x-axis, we have 1 minus specificity, and on the y-axis, we'll have sensitivity. The area under the curve, or the AUC, can then be calculated. This ROC summarizes the predictor across all cutoff values. All in all, there are some diagnoses that are more clear predictors of developing diabetes. However, we rely on clean data and accuracy of the model to be sure that we can use these predictors. Additionally, informatics professionals must also consider that the use of EHR data also relies on the clinician to appropriately enter the data. In this case, the clinician must appropriately enter the ICD-9 diagnoses for each patient. Thank you for your attention, and here are my references.